The NHS could be set for more strike chaos in the new year after the Royal College of Nursing warned the, quote, revolution they believe is needed failed to materialise. Pat Cullen, the union's militant general secretary, said this year's walkout only led to modest progress in pay and staffing levels and more action is needed. And she added, 2024 is a general election year and every party will be challenged by the RCN to demonstrate clear vision and hard cash for nursing, the NHS and social care. Let's make sure we again push ministers further than they want to. NHS England said a whopping 1.2 million appointments had been axed due to industrial action since last December, and nurses actually accepted a 5% pay rise earlier this year. Well, to discuss this, I'm now joined in the studio by a lovely nurse, Sarah Jane Palmer. And Sarah, interestingly, these strikes, clearly there, Pat Cullen saying it's an election year, let's make ministers go further. This is becoming nakedly political.
Yeah, it is. And I think it's just unfair on the patients because clearly we've got 7.7 million on the waiting list. And as you say, so many appointments were axed due to strikes. I just don't think it's in the best interests of the patients to strike, and morally it's wrong. A
lot of people would agree with that, but of course nurses, many would agree, watching the show, are underpaid, undervalued and deserve more. Do you think we should go as far as outlawing strike action for nurses?
I think so, yeah, to be honest, because they've done that with the army, haven't they? So why not with nurses? Nurses are essential to the care of patients. You can't really make staffing safe. If nurses go on strike, I mean, there was a US study that found that the mortality rate rose by 19% when nurses walked out, and they had apparent safe staffing set in place. I think the so-called safe staffing is having the absolute skeleton bare minimum staffing, and there'd usually be agency nurses that don't even know the patients. So, yeah, I think that it should be outlawed. I just don't think it's right to do that.
But if you think that way, how will you ever get a fair pay deal if you don't down tools and make them listen? Presumably, if you play along with, being Mr. and Mrs. Nice Guy, the government will just take advantage ad infinitum.
I mean, that's a good point, and that can happen. But I also think it's about how the NHS itself structures its pay for all of its workers. I think there are too many Band 8 managers sitting looking at spreadsheets, and there are too many managers. I think if they reorganised things a bit, maybe they'd have more money to give to the nurses. And I think maybe they can look at the current pay, the pay scale, the way that it's done, and yeah, just reorganise things. They've got so many back office managers and things. So.
Yeah. A lot of people, I'm sure, watching this will be crying out in agreement with you. They'd like to see more nurses on the wards, saying they'd like to see more coppers on the beat and less pen pushers. Do you feel that that's a morale issue amongst the working nurses on wards? They feel there's just too much money being frittered away on top brass?
Yeah, I think so. I think, a lot of nurses feel not only are they underpaid, but there's low job satisfaction when you see there are so many Band 8s getting paid a lot of money, and then there are the nurses at the lowest end of Band 5 are probably working the hardest out of everyone. So I have true empathy with them, and I think they deserve more. But I think strike action just can't be the way to get it, because it's not safe, really, in my opinion, even though they've said it is. So.
And what more could be done, do you think, in as far as attracting nursing people to the profession in the first place? Would you like to see free bursaries, particularly for the working classes, for the lower earners?
Absolutely. I'm not sure of the bursary system right now, but when I did it, it was means tested. At one point, it was just a universal bursary. I think really student nurses do so much hard work that they should be paid for it. There's a dropout rate from unis of, I don't know, I think it's about 50%. When I trained as a nurse, about 50% on my course dropped out. There's such a high dropout rate, and I think that partly is because you're working basically for free in some cases, or you're getting a bursary that's very low. So there's not much incentive there to actually go into the profession. I also think bullying is a massive issue, and that's cost the NHS. They found in 2019 that due to staff absenteeism as a result of bullying, there was a cost to the taxpayer of 2.3 billion. And Matt Hancock had said that he would address the bullying issue in the NHS, but of course then the pandemic happened and got in the way of that. So I think there's a cultural issue, not only caused by, the pay issue, but it's actually the morale of the staff caused by an issue with bullying among every grade of staff, and it's quite rife among the nurses in particular, from my experience.
Superb. Well, thanks for joining us on the show today, Sarah Jane Palmer.
Thanks.
Wonderful points. Very, very well made. Thank you for your service.
Thank you.
OK, we'll be discussing Labour's immigration plans at 5 o'clock, and they've been accused of dancing to the Tory tune. Maybe not such a bad thing, but can